So thank you very much. It is my great honor to be here. I appreciate the invitation to speak with many of you. I've had the great fortune to meet many of you, but many of you I haven't, so it's a great pleasure to have this opportunity. I hope to continue the dialogue after today. So if you're not familiar with AARP, we are a nonprofit, nonpartisan organization with 37 million members, age 50 plus. Our purpose in life is to help those live their best lives as people age. And we fight for issues of most importance to people 50 and older and their families. And you can see here that our 3 priorities at AARP are health, wealth, and self. And that goes very nicely with the theme that we heard yesterday of that wealth, these ideas of what are most important to people 50 and older, exactly like Sura's slides, health being the most important. But we consistently poll our membership to find out what is the issue of most concern to them as they age. And tied for first place consistently over the last decade of these surveys that I've been following is the future of Medicare, tying in with the importance of health, the importance of Social Security and the future of Social Security, but equal in concern to people 50 plus is the ability to stay sharp throughout their lives, because of course it means the ability to stay independent and enjoy their lives. So AARP's focus on the issues of this convening are around, and my personal work has to do with the public policy issues around these. But our organization has 7 major different priorities and programs that we're working on to address these issues. I'm going to focus on the ones in big, bold letters today, but I just wanted to mention several of the other ones so that if you're interested, you can learn more about them. So Staying Sharp is, and you can check that out at stayingsharp.org, it's a digital platform where people can go to learn information about what helps from a holistic approach to maintain cognitive health as they age. And it's focused around the 5 pillars that we like to call them: move, discover, relax, nourish, and connect. And all of those elements we've heard a little bit about in the panels that we've discussed today. But the idea is to keep sustained activity around these issues and serve up suggestions for people. So you can go to the website, you can take a neuro assessment and evaluate, find out where you are relative to yourself. And you can do this evaluation over time. And then AARP, from a digital platform, will serve up suggestions in each of these areas around exercise, diet, social connections, for example, and provide suggestions for people to help them stay sharp. I wanted to mention Dementia Friendly America because we were talking a little bit about what are the systems that are necessary to be put in place to enable people to take the measures that help them stay sharp. And I see some partners in the room. The Dementia Friendly America is a national collaborative of organizations working in communities to make sure that private sector, public sector, community groups of all kinds have the ability and recognize people living with cognitive impairments and try to make the systems from a public health perspective operate better for people with cognitive impairments. So I invite you to check out Dementia Friendly America. In fact, there is a bank and financial services toolkit specifically available on that website, making suggestions along the lines that Naomi mentioned about things that the financial sector can do to improve the lived experience of people with dementia and their caregivers. And then AARP's Fraud Watch Network has been in place for many years, where we give access to consumers about how to protect themselves with flagging what are the most recent scams, watchdog alerts, what are the con artists up to, And we have a 800 number available across the country to call up for anybody, whether you're a member or not, to find advice if you've been victimized by fraud or feel like you're about to be. And the last point on this slide, Jason mentioned the IOM recommendations on the public health dimensions of cognitive aging. And I know the executive summary is in your folders, and I recommend you take a look at it. But in particular, the recommendations of the IOM that are of great importance and relevance to the conversation here is IOM recommendation number 9, which is specifically directed to financial decision-making in cognitive aging. So AARP is working collectively with partners, the NIA, the CDC, other federal agencies, on implementing many of the recommendations. But 9 in particular is a call out for the banking and financial services industry to develop and disseminate banking and financial information that assists older adults and their families in making decisions so that they can reduce opportunities for unsuitable decisions and mitigate the harms of such decisions. And so as I was preparing this conversation, or my talk today, I thought, what is at the heart of what AARP is trying to do in this space? And it's what we've all been talking about, and that is that an ounce of prevention is worth a pound of cure. Now, I couldn't help myself being in the city of Philadelphia, and so you know who is attributed with this saying here. So many of you know that Benjamin Franklin, and look at that, he's an old guy with lots of wisdom to share. He died at age 84, but he had plenty of aphorisms and incredible things to say. One of the things that he said, of course, he was one of the founders of some of the precursors to the University of Pennsylvania. He used the phrase, an ounce of prevention is worth a pound of cure, as a firefighting tool. And in fact, came together and instituted a insurance system to have people, because aware that a catastrophic loss like a fire would wipe out entire economic savings, he helped fund an insurance fund around fire for the city of Philadelphia. But I think it's particularly appropriate for us to think about as we are doing that, because as we are gathering here today, because what we're talking about is how to prevent a horrible economic crisis for older people when we're thinking about how to protect and create systems in which people can make the right decisions. But his other aphorism that I wanted to share with you was, tell me and I forget, teach me and I may remember, involve me and I will learn. And that is from a perspective of people with cognitive impairment and how you engage them. It's the involvement point that is important. And so I wanted to emphasize both of those aphorisms for you. And so when we talk about involving older people in their decisions, the two things that AARP has engaged with that I'm most familiar with and I want to share with you today is about the Global Council on Brain Health. We're trying to involve people as they age in their own cognitive wellness. And Jason Karlowicz is on the governance committee of the Global Council of Brain Health. And AARP and Age UK recognizing both the need for people to engage on this topic and understand what it is that they can do to maintain their cognitive health, founded the Global Council on Brain Health in order to bring the best that science, the state of the science, has to offer in telling people what they can do. Now, many of the panelists yesterday were talking about that we need further science in this space. Yes, we do. But we don't have to wait until we have all the answers to be able to give productive information to people about what they can do with respect to exercise. We've got really good evidence in this area. And the Global Council on Brain Health just met in Vancouver a month ago and is working on what are the practical recommendations we can provide around physical exercise to help people, because that's the area that we have the greatest amount of evidence on. So I'm happy, I've got my 2-minute warning. I wanted to just tell you that I'm happy to share more with you about the Global Council. The other major initiative is what we're calling Bank Safe. Now, you all were kind enough to, Dominic provided copies in the back. If you haven't seen one, this is a great report. It'll tell you more than anything I can in the 2 minutes I have left remaining about the Bank Safe program. But again, the idea is we need to partner with financial institutions and with other nonprofit organizations and for-profit organizations to get this right. So, I'm going to share with you a couple of pictures, and I'm wondering which of these people have cognitive impairment. Can you tell? I have no idea. They're just pictures on the internet. But the point is, when they come into your financial institutions, you can't tell. And when they come in with a caregiver, the attention is almost always given to the caregiver. Are you kidding me? We're talking that even by the age of 85, about 50% of people might have cognitive impairment or dementia. That means 50% don't. So we have to think in the context of older people, take them individually, involve them, ask them, engage with them to understand whether or not they do. And I guess that's my bottom line message, that it's really critically important to do this and to consider them, but realize that they're humans and they're individuals, and you have to make individual assessments on the point. So my closing is that an ounce of prevention is worth a pound of cure, and that somebody's even gone to the trouble of quantifying it. And I hope that you all can think about the enormous difference that you can make in the lives of people who have cognitive impairment by paying attention to the signs that you'll be able to see.
Sarah?